Okay. So, hello, Mary, and thank you for agreeing to share your career story with us as part of the Royal College of Nursing's Once Upon a Time History of Children and Young People's Nursing exhibition. So, can we start by you just telling us what your name and current roles are?
Yes, thank you, Sue. So, yeah, my name is Dr. Mary Marshall, MBE. I am Deputy Director of Nursing for Nursing, Midwives and Allied Health Professionals and MAPS Research and Innovation. And I also, in my role, I'm Consultant Nurse for Healthcare Transition and also an Honorary Professor in Children and Young People's Nursing.
That's a busy day, Mary. Could you tell us a little bit then about how your career in children and young people's nursing began?
Yeah, well, actually, my career in nursing started in 1982 when I commenced my nurse training to become an enrolled nurse general, that is. To be fair, the truth was when I applied for nursing, I really didn't understand the difference between the enrolled nurse pathway or the registered general nurse pathway, other than the enrolled nurse training was just over 2 years and the registered nurse training was over 3. And of course, eager to become a qualified nurse, I believed the AN route would help me achieve my aspirations sooner to become a nurse. The EN training program consisted of clinical assessments and also a very theoretical component as well in terms of that assessment. I qualified then in 1984 as an enrolled nurse, or really as it was more commonly known then back in the day as the bedside nurse. And my first appointment as an enrolled nurse was in children and young people, was with children and young people, a field of practice that I continue in today.
Right. So how did you respond then when the role of the enrolled nurse was phased out?
Well, as the nursing profession developed and changed, it didn't come as a surprise in terms of I wasn't a practicing enrolled nurse, and I was very in tuned in terms of the practice of nursing and where that was heading really. So I became acutely aware then of the impact. If they were phasing out the enrolled nurse route, then that would have a big impact on potentially my career in the future if I was to stay in nursing, which I clearly did. So I basically then was offered, as enrolled nurses were at the time, the opportunity to undertake a full-time conversion course to become an RGN. And I undertook that opportunity. And then in 1992-93, I embarked on that full-time course. And that program was really interesting as it exposed me to the theory of evidence-based health promotion. And then from about 1993 to 1998, I worked with children and young people as a staff nurse, what would now be known as a Band 5, really.
Okay. So a lot of work. And then you decided you'd already converted to a registered general nurse, and then you decided to become a registered sick children's nurse. So what made you decide to undertake your registered sick children's nurse training?
Well, by now I had a lot of experience in children and young people's nursing, but actually without the registered children's nurse qualification, I knew in terms of career progression, the fact that I didn't have my RGN would perhaps, dampen down what I could go on to achieve in the future, potentially holding me back in terms of career advancement and development. So that was really a conscious decision then. To seek out the course, the registered children's nurse course, and continue to professionally develop in the line of my chosen field of practice, really, which I knew by then I wanted to stay within. And again, I was very fortunate in terms of opportunities that were out there at the time. Although they were highly sought after and competitive, I was ever so grateful that I was successful in applying to do my registered children's nursing at John Moores University in Liverpool. And alongside that was then recorded as a diploma in higher education as well. So in actual fact, that was, in terms of opportunities it presented, it also gave me that academic qualification alongside that really clinical practice qualification. And it was there really doing that course all those years ago that I first exposed me to research and different research methodologies. And I guess that's where you could say my interest in research started from.
Okay, so then once you'd obtained your RSCN, Registered Sick Children's Nurse qualification, and you worked in that role for a few years, did you then specialise in an area of children and young people's nursing?
I did, yes. Again, keen to develop my clinical skills. It'd be about 1999 to 2000 now. I was appointed as a community specialist practitioner, working specifically with as a paediatric diabetes nurse. And again, in terms of ensuring the academic side kept pace with my clinical professional development, I was also offered an opportunity of undertaking a BSc Honours and looking at the qualification in terms of that children's community nursing qualification alongside that. And again, I went to the University of Central Lancashire to do that, which again, in terms of your exposure to the academic side of things and working that against the professional development, it was whilst I was doing the BSc degree that whilst doing my dissertation, I became really interested in actually looking at the evidence base behind the clinical practices of paediatric diabetes nurses, and realised that actually the evidence base was just not really there in terms of the type of work that we were exposed to in working with our children, young people and their families. And from my dissertation, I was able to go on with the support of the supervisory team to produce my first scholarly paper, and therefore my first publication.
Wow. So you've mentioned the importance of research a couple of times now. So can you tell us a little bit about how you developed your research career alongside your clinical career?
Okay, so yeah, so it'd be about from 2005 to 2010, I continued to work in my area of specialist practice, which was obviously paediatric diabetes. And although I progressed my career, I was very conscious still that in terms of the research evidence relating to the experiences of children, young people and their parents and carers around the lived experience of having either a child or yourself experience diabetes, that the evidence just was really, really limited. And that urged me then, in terms of understanding more about why we don't hear the voices of children, young people and their families, that really urged me in terms of thinking how I could do something about that for myself, because it was going to impact my practice and hopefully enable me to develop in my practice. And then it was around 2005 I embarked upon a part-time PhD with the University of Central Lancashire. Although this did prove a challenge while working full-time and doing a part-time PhD side by side, I have to admit there was huge challenges.
Yeah, hard work, but amazing, and one of the first children's nurses, I think, to obtain a PhD. So absolutely amazing. And was it easy then to find a role where you could use your clinical and academic skills effectively alongside each other?
Well, as you mentioned, Sue, in terms of where I was on that academic level, there really wasn't anything in terms of organisations or individuals that also held a PhD as a clinical practitioner, a working clinical practitioner. I guess the only thing that was like to that is working in a university setting where the research is very much led by the university. So when I completed mine, it was a difficult challenge for me personally, because I'd come back with all these new skills that almost my organisation weren't ready for at the time, because nurses, midwives, and allied health professionals, more commonly known now as NMAP, we didn't at that time have a pathway in terms of that continual and professional development as a clinical academic, unlike our medical colleagues who have almost that from the very beginning of their training. So it was a difficult option and a difficult choice to make as to whether I stayed clinical with these new skills and when I was going to then be able to work with these new skill sets in terms of producing more evidence, more research, and whether or not I go into the university full time and move really away from patient contact, or actually get the opportunity of developing more research that would be relevant to children and young people. But I guess that, you know, for me, there was no real decision to make. I think that my first love has always been clinical practice. And what I did was I kind of made links from practice into the universities and kind of made my connections, my networks, my collaborations from the clinical side into the academic side of the role. So I was able to start blending clinical and academic together with relationships from both higher education and health.
So you chose to remain in that clinical role so that you could use your clinical skills. How did you use your research skills then in that clinical role, Mary?
Yeah, so I was very fortunate in terms of opportunities that were then coming my way in terms of secondment opportunities. With as I mentioned earlier, the higher education institutions who actually knew now of me, of my work clinically, but also we had relationships now with the university in terms of some of their teams there. So I was offered part-time honorary research associate for 2 days a week with the University of Manchester. So they bought me out, if you like, from clinical practice for 2 days a week to work on specific research studies, my own included. And then once that secondment came to an end, I then was invited to take part in a project with Public Health England, again, to work on a specific project where I was able to continue to develop as well as use my research skills. So got the best of both worlds, really, in terms of being able to have those experiences and develop myself professionally and personally as well.
And how would you say children and young people have benefited from your research skills?
If I go back to my timeline, I would say in 2017, I was successfully appointed as consultant nurse for healthcare transition within Manchester University Foundation Trust. And this role provided the opportunity of also being 50% clinical and 50% research stroke academic. My work had a strategic focus across the organisation, very fixed on children and young people with long-term conditions, moving from children's to adult services. And what that role enabled me to do was to take on some postdoctoral research, design a postdoctoral research study. And the findings from this study, which were alongside healthcare transition with our children, young people and families, that the findings from that research study then enabled me to put a business case forward for a youth worker service for here at MFT. It was also during that time, though, I was also doing a Florence Nightingale leadership programme. And it was that leadership programme alongside the research that I was doing that really gave me the you could almost argue the confidence as well as the support that was needed to be able to take the research to the next level in terms of that national profile, whilst at the same time professionally developing a national profile around healthcare transition and children and young people with long-term conditions. So moving it, away from the organisation onto a much more national footprint.
Yeah. And I know, Mary, that from our years of working together, many years, that you've done a lot to continuously improve services for children and young people. And just tell us a little bit, opportunity to blow your own trumpet, tell us a little bit about how this has been recognised nationally.
Yeah, so thank you. So in 2021, in terms of recognition, the Chief Nursing Officer for England presented me with a gold award for my services to children and young people's health. And then in that same year, well, just over the following year, I was also in the New Year's Honours list and awarded an MBE presented by Prince William for my services to children and young people's health, of which I feel immensely grateful and proud to have received and be recognised in such a way for a job that I just love to do.
Yeah, amazing. And congratulations. I mean, they really are amazing achievements, Mary.
Sure, absolutely.
Can you tell us then a little bit about how you've shared your knowledge and skills that you've developed over the years with other nurses, midwives, allied health professionals to help them develop their practice?
Yeah. So I think there's a big part of me that likes to believe that actually for nurses in particular, in terms of an example to follow, I like to feel that for those I work with or that know of me, that actually they absolutely understand that the work we do, the significance and the responsibility we hold with working with children and young people is huge. So for me, I share a lot of the works that I do. I share it within my organisation, and I also share it much wider in terms of national and internationally. I'll be asked to speak about the works that I do and what the impact has been. So again, through that and through publications, just to ensure it reaches a wider audience in terms of the works that we've done and what changes have been brought about. Not on my own, it's often a collaboration, that we've been able to bring about changes, we've been able to bring into practice the evidence that's been required where there's been a gap. And I think in terms of nursing and children's nursing, bringing that forward, it's just having that footprint there and having a base in which to continue to work and to grow on. And professionally for me, it's enabled me to go on and, as an MMAP researcher, I've now become the clinical lead, one of the clinical leads for the women and children's domain of the Manchester Academic Health Science Centre. Ordinarily, these leads go to medics. So again, very, very proud to raise it for our nursing profession in terms of driving that forward. It was this year that I was appointed the Deputy Director of Nursing for NMAP Research and Innovation here at the Royal Manchester Children's Hospital, alongside my role as consultant nurse. And then most recently, in just August of this year, I was appointed as Honorary Professor for Children and Young Peoples with the University of Salford. And again, all of these roles all enable me to help drive our profession and our practice forward, and have research very much at the focus of the evidence of the care in which we give and deliver to our young people, children and their families.
Yeah. So Mary, thank you so much for sharing what's been a phenomenal career story with us. And I know a lot of people will find it incredibly inspiring to just see how you've achieved what you've achieved. And it really demonstrates that the education opportunities that are available to children and young people's nurses can support such a diverse and successful career. And you should have the final word. Is there anything then that you would like to say just to end on, Mary?
I think when we start our careers, we never quite know where they're going to take us. And I have been, I've benefited immensely from taking the opportunities that really, that were afforded to me along the way. And what I would say to our nursing profession is to continue to take use of those opportunities that come our way and continue to drive our profession forward. I've been really fortunate. I've had some really great support at the back of me to enable me to get to the place and stage I'm now at in my career. But equally, we can all contribute to that professional development in ourselves just by taking those opportunities and really use them to make a difference.
Absolutely. Thank you.
Thank you, Sue. Thanks for listening to my story.